Hey guys, it's Matt. Just getting back to you after the first Isolaz treatment. Just going to explain a little bit to you about what happened and the outcome of it. First of all, to explain a little bit about it, it was pretty much a machine, a handle with a suction cup on it, that just sucked the bacteria out of my face from your pores, and then a broadband light flashed and killed all the bacteria in your face. I'll show you some footage of that from the dermatologist's office, and the dermatologist will describe to you a little bit else what's going on, and you'll see some of the actual footage. The outcome of it, as I was saying, the dermatologist was talking to me and did explain to me that the first treatment I'm not going to notice any major changes in my face. But I did notice that there was a little bit of the redness that did dissipate, as well as my face was noticeably softer. So hopefully we'll get a better outcome after the second treatment. So here is the footage, and I hope you guys enjoy. Thank you. Hey guys, it's Matt. I just got to the dermatologist place. We are going to go inside and meet my doctor and do some paperwork and get my first treatment, and you guys will see that soon.
Well, welcome. What I want to do is explain a little bit about Isolaz. So handpiece-wise, this is the handpiece. This is a small tip. This is the tip that's usually used for the nose, or if you have an individual lesion. We have a larger tip that we use pretty much pattern-wise throughout the face. Okay, so those are your different tips. The beauty about Isolaz is it's approaching acne 3 different ways. At the heart of acne is a clogged pore. So a clogged pore from oil production called sebum, a clogged pore from bacteria or dead skin cells. So I'm going after the oil gland, and we kind of remodel and destroy the oil gland. I'm going after the dead skin cells, and that's that extraction. And then also the extraction technique widens your pores, and we can deliver heat and energy greater down your pore. So we got 3 approaches, which is fantastic. Yeah. A lot of other systems only have 1 approach, just heat. So you're lucky, you're going to get 3. We typically try to do it twice. We typically try to build up in strength, so in energy and heat. Side effects we always talk about is there is a little bit of a discomfort, heat or discomfort. There can occasionally be bruising. That suction might be too tight. So we always make sure that somebody does not have pain medication on board, like aspirin, Advil, Aleve, good things like that. We'll also talk about what you're supposed to use in between. What are you using right now?
Actually, it's a skin line called Become.
Okay.
It's like a foaming cleanser.
Okay.
And then there is it's like a soft exfoliator.
Perfect, okay. What we'll probably do is you can use that up to the day of treatment, but depending on how you react, you might take tonight off, you might take tomorrow off. You will leave here looking red, absolutely. Red from heat, and red sometimes from extractions, from removing pus and things like that. Back and forth. What we'll do next is we'll start to cleanse your face. What we use is a Clarisonic. It helps remove the oils and the dead skin cells the most. Excuse me. Then we also combine it with a little bit of a leave-on salicylic acid. So that's where we go next. Sound good? Okay.
How are you feeling?
Really excited.
So Matt, I'm going to be using a sensitive skin cleanser on you with our Clarisonic brush. Now, Clarisonic is wonderful for acne. It was made by the same maker as the Sonicare toothbrush, so it kind of penetrates down and oscillates around those pores to get out any excess dirt or bacteria or oils. So you're going to feel just a little bit of vibration on the face. Are you ready? Fantastic. It can tickle a little, so you let me know, especially around the nose. So this is really going to cleanse the pore before we start doing the Isolaz treatment and open them up for better penetration of that light. How are you doing?
Good.
Using a 2% salicylic toner, so that's going to clear up some of the oils and penetrate down to the pore.
Ooh, I feel it.
And you may feel a little bit of tingling, and even if you have some open acne lesions, you may feel some stinging. That's normal, and it usually dissipates within about 15 to 30 seconds.
Feels good though.
Yeah, it feels clean, right? Perfect.
The biggest surprise, I think, for the treatment is that every spot that we go to, we spray cool water on it. It kind of helps diffuse some of the heat. So I can guarantee you, people who have been on their 6th treatment, even when Lauren and I prepare them, here comes the spray, they always blink and shudder. So, but it's just cool water, creating a good barrier between the laser.
I'm going to twitch, I probably.
Yeah, absolutely. What you'll notice Lauren and I will do, we'll talk. We'll say, I'm on the left cheek, we're going to spray the chin, we're going to move to the right cheek, so we guide you through it.
Okay.
If I'm correct, I'll do the forehead at a pretty low setting, because the forehead looks pretty great. You do have some individual pustules kind of in the middle that I'm going to walk you through. I'm going to individually essentially zap or treat those, but I'll let you know. What we're going to start with first, I'm going to have you look towards your right shoulder.
I'll start
And
on the
Lauren's
cheek
going to
here.
spray.
So
your
you're
left
going
cheek.
to hear pretty loud little spurts here, and you'll feel some cold water on your cheek. So I'm going to spray. Start now. Ready? And we'll wipe down the chin.
I usually start here on the jawline, just because in case there's redness or any bruising that develops, it's far away and I can tell pretty quickly. I'm also kind of coming in at a medium strength. Even though you have a darker skin type, you're not very, very tan right now. So what you're going to feel, first you're going to feel the suction, then you're going to have a little bit of a zap, and I'm going to be right here. Tolerable?
Awesome.
Good. Your skin's not red, looking perfect, which means in a nice way, when I treat it in just a second, I'm probably going to go up in strength.
What does it feel like?
It almost feels like it's something just like squeezing my cheek real quick, and then it lets go, and then it feels like it's like steam just going on my face. Feels good though. This is cool. Sorry.
That's alright. We're going to move to the center, so we're going to spray the chin.
Okay, Matt, you're going to feel a little spray on your chin.
So I'm going to have you tuck in your bottom lip. Fabulous. As I get close, it's going to feel like tug of war. You're doing great. Nice and easy breathing outside the nose. I'm almost done with this cycle on the chin.
How long have you been doing this?
So Isolaz is probably about just under a year. So it is in a great way, don't worry. Newer technology. We're going to spray the upper cheek.
Okay, you ready, Matt? Any spritz?
I think for me, what kind of captivated me is that using technology, because I absolutely love laser technology, using laser technology to kind of go at the heart of acne is fantastic. Warmer. So I'm spot treating for extraction purposes on just individual lesions. What we're going to do is spray the chin.
Okay, you ready, Matt? So just a little spritz down here.
I'm going to be on this one right here on your right chin. Okay, so that second one, right?
Yeah, that was a little.
Yes.
That was
A
weird.
little more intense.
Yep.
Doing great, and that's the fantastic extraction that we're kind of looking for.
Alright, Matt, so what we're using is Cleanse and Treat 2% salicylic acid, and we're just going to use it on the cheek where we did those extractions there. Same kind of thing as the toner, so you may feel a little bit of stinging. It should dissipate quickly. You ready?
This is weird that I can't see out of it.
Yes, that's why we try to do so much talking, but you're absolutely correct. So any other successful topical treatments you've ever had? Creams, lotions, potions?
Like I said again, that Become Skin line, that's probably the best one that I've used.
Good, because it's gentle enough?
Yes.
Great.
Okay, so now what we're going to do is just a 5% leave-on benzoyl peroxide. That'll help clear any of this bacteria that we kind of loosened up in the skin. and kind of keep your skin nice and healthy and clean. Same kind of texture as before. May sting a little in the areas where we got those good extractions. So if you look in the Isolaz tip, you can see one of the extractions we did on Matt today. So we got a really good extraction in there.